webinar.
Audio recording for this meeting has begun.
Hello everybody and welcome. My name is Jonah Begay with the Telebehavioral Health Center of Excellence, and this is the Domestic Violence Prevention Technical Assistance webinar. And today's session is on how to apply for new applicants. We're joined today by Ms. Audrey Solomon. Before I turn things over to Ms. Solomon, here's a quick orientation to the layout that we have for this webinar. The upper left-hand corner will be for questions and comments. You can type those in at any time during the presentation. Just know that once you do submit your own question or comment, you won't be able to see it right away, but just know that Ms. Solomon and us and the other hosts will be able to see the questions as they come in real time. Lower left-hand corner is today's presentation in a PDF format. You can download this at any time by clicking on the title itself. It'll highlight blue. From there, the Download Files button will become active. Click on that. It'll take you to a new window, new tab, and then you can follow the prompts from there. If you're using the latest version of Adobe Connect, just simply hover your mouse over the title and then click the download icon. It's a downward arrow facing into an upward bracket. Click that icon, and then you'll be asked where you would like to save the file. Lower right-hand corner is the technical assistance. If you're having trouble seeing the slides, you're not hearing the audio very well, please let us know there. Join us in the background as myself and Mary Toledo. We'll try to help you out as best we can. So with that out of the way, I'm going to turn things now over to our presenter. Thank you.
Hi, good afternoon, everyone. Again, thank you, Jonah, for that overview of some of the technical items for today's technical assistance webinar. Again, my name is Audrey Solomon, and I will be conducting the Domestic Violence Prevention Technical Assistance webinar on how to apply for new applicants today, December 6, 2021. And so before we go over the purpose of today's webinar, I just want to make sure everybody knows who I am. I currently serve as the National Program Coordinator for the Substance Abuse and Suicide Prevention and Domestic Violence Prevention programs within the Indian Health Service Division of Behavioral Health. And today, as I go over the information for this Notice of Funding opportunity, I will be referring to this particular funding opportunity by the acronym of DVP, which stands for the Domestic Violence Prevention Program. So again, if you are just joining us today, we will be going over some information on the recently released Notice of Funding opportunity that was posted to the Federal Register on November 4th, 2021. So as of today, the funding opportunity has been available to the public for 33 days. Applicants have a total of 90 days to submit applications, giving everyone the deadline to submit of February 2nd, 2022. And if for some reason you haven't already, please make sure that you access and review all of the information in the DVP Notice of Funding opportunity that is posted to the Federal Register. You have that link here on this slide, and if once these slides are available, you'll be able to click on the link itself, and I think that Jonah can possibly put it in the chat or technical assistance box for everybody as well. So if you haven't already, like I said, please do review that the full NOFO, so that you are familiar with all of the content, so that you can ask any pertinent questions that you might have for this NOFO. So again, today the purpose of this webinar is to provide technical assistance to all new applicants that are either tribal organizations or urban Indian organizations on the application submission process. So really what we're going to do is provide you a very brief overview of the DVP NOFO itself. I'll go over some key information about the application and the submission process. I'm going to provide a very high-level review of the application proposal requirements. I will also talk a little bit about the proposal or some templates that are available for for the DVP funding opportunity. We'll go over a few tips on how to prepare a strong application. I will give you a brief overview of how applications are reviewed and selected. You'll be given a few resources to reference during the application process, and then at the very end, you will receive contact information for all of the IHS agency contacts that you are able to reach out to should you have questions about this funding opportunity. So for those of you who are either new to the domestic violence prevention program, this slide provides you some very general background information, starting with the demonstration phase, which began in August 2010, and then going through the most recently funded cohort, which we call Cohort 1 of DVP. Now, I won't read this information over to you in detail. This is really just meant for folks who are unfamiliar with the background of the program, the history, and where everything began. So I just wanted to make sure you had this information. This information, of course, is also included in the NOFO, but I just wanted to give you a reference point of when the DVPI program began, when we moved into a fully funded IHS program and became known as DVP, and then now moving into this new funding opportunity for the second cohort here in the Division of Behavioral Health. So now we'll move into some more specific information about this new funding opportunity. If you are familiar with the Domestic Violence Prevention Program, you are aware that in the first competitive funding cycle that recently just ended in September 2021, grants and awards were actually funded under what we called at that time Purpose Area 1 of the DVPI or DVP program. It's important to know that this new funding opportunity is now being announced as its own distinct funding opportunity, which is this particular notice of funding opportunity that we will talk about today. This NOFO focuses specifically on prevention of domestic and sexual violence among American Indian and Alaska Native people. And really, again, we are continuing to promote the development of evidence-based and practice-based models that represent culturally appropriate prevention and treatment approaches to domestic and sexual violence from a community-driven context. If you would like to know a little bit more about the previous DVP grants and projects that were funded in the first cohort, you can visit the About DVP webpage that's listed here on this slide for more information. So really moving into the purpose of the current grant funding opportunity, IHS is really looking to continue to support the development or the expansion of a DVP program by incorporating prevention efforts, of course, those addressing social, spiritual, physical, and emotional well-being of victims through the integration of culturally appropriate practices and trauma-informed services for tribes, tribal organizations, and urban Indian organizations. This particular NOFO does aim to promote prevention efforts that address both domestic and sexual violence, including sexual exploitation, human trafficking, and missing and murdered American Indian and Alaska Native people, and child maltreatment. So really what we are hoping to see from applications is a cross-system collaboration approach with other portions or organizations within your community. Sorry about that. And addressing violence in that manner where it includes raising and mitigating the negative health effects and social burden within communities. Again, the Notice of Funding Opportunity will give you a very specific and more detailed breakdown of this NOFO and its focus on prevention efforts with those categories that you see listed here. So please definitely take a look at the purpose section of the NOFO for some more detailed information. We do want to reiterate that this is a funding opportunity that is and will be a grant award, which is why it is available to tribes, tribal organizations, and urban Indian organizations. The total estimated funds available for awards is just over $7.8 million, and we do anticipate the individual award amounts for the first budget year or the first project year to be between $100,000 and $200,000. The anticipated number of awards will be approximately 39, issued with under this program announcement, with a set aside of up to 5 awards being made to eligible urban Indian organizations, and at least 1 award will be made in each IHS area from which applications are received. As in the first cohort, this Notice of Funding Opportunity is for applications are being accepted for a 5-year funding cycle. So keep in mind that when you do submit this application, it is anticipated that it will be conducted for a total of 5 years. Moving on to who is eligible to apply. As I mentioned in previous slides, this is a grant funding opportunity, and applications are being accepted from federally recognized tribes, tribal organizations, and urban Indian organizations. And the very specific definitions are listed with more information in the NOFO. And what you see here are the reference points for each definition that we include in the NOFO. So if you are wondering if you are eligible for this funding opportunity, please do go to the NOFO and read over the specific definitions for each of these eligible entities to see if you meet this criteria. The eligibility information is located in Section 3, so if you haven't already, please do go to that section and review the information. And we did also want to note that all previously funded DVPI and DVP grantees who are either within the demonstration phase or funded in the first cohort must submit applications for this new funding opportunity in order to be considered. So I did want to, I do see a question in the chat, just really quick before we move on. Krista's question, so 100 to 200,000 per fiscal year for 5 years, totaling between 500,000 and $1 million. Yes, Krista, that is correct. So if you were, for example, awarded $100,000 for the first year, that would be reoccurring for subsequent years up to 5 years, depending on the availability of funds. Again, just to reiterate that all applications are being submitted via grants.gov, and the deadline to submit applications is February 2nd, 2022 by 11:59 p.m. Eastern Standard Time. And you will see me reference this deadline throughout today's TA webinar. We just want to make sure that everybody is clear and understands when the deadline is. So next we'll move into what is actually Section 4, the application and submission information within the NOFO, and what we will call today in this webinar is preparing your application, or preparing the application. Putting up some key dates to remember for all potential applicants. We wanted to list those here for everybody. Right now, we are not exactly sure of the Objective Review Committee dates, but those will definitely be listed on the websites once those are confirmed. That really just depends on when we get to the after the deadline and how many applications we get and how much time we need to devote to that process. In the NOFO, it does state that the earliest anticipated start date for any new grant awards would be March 21st, but do keep in mind that with timelines, that date might fluctuate by about a week. So they give you that information just so that you can prepare to potentially start on that date. Because the applications are required to be submitted via grants.gov, it is very important that you remember to register as a grants.gov entity or organization if you are already not registered. Keep in mind that this can take up to 15 business days, so please verify your registration and or get registered as soon as possible because there are a number of funding opportunities available at any given time. You want to make sure that your registration is processed and you're ready to submit an application on or before the deadline via grants.gov. You are not able to submit your application via email or any other way. That's why we want to make sure that you are given the link where you can register and find other information at grants.gov. That's the link there in the middle of this slide. And then once you are registered at grants.gov, please do make sure you take some time to be familiar with the website, take a look at the features that are available so that you can submit your application without needing to troubleshoot on your end. If, again, if you have not taken a look at the NOFO for the DVP NOFO in detail, you can actually search for the NOFO on the Search Grants tab on grants.gov. That is the funding opportunity number you see there on the second to the last bullet point. You can also make it very easy on yourself and go to the IHS Division of Grants Management website, the website that you see listed on the last bullet point, and look or click under funding opportunities and you'll be able to pull up the notice of funding opportunity very quickly so that you can review all the information. Before I move on, I do see there is another question in the chat. So all the other 69 projects will be competing also for the 39 grants. Carol, I'm not sure what you mean by other 69 projects. May I assume that you're talking about the 69 projects that were previously awarded in cohort 1? If that is the case, if any previous projects decide that they want to reapply for funding, then yes. All applicants would be competing for the same funding. So yes, and Carol, I see your other responses. So thank you. It's not we can never know who exactly or if previous grantees would be reapplying for the funding, but it is safe to say that if folks want to continue with their previous work, that they would apply for this funding moving forward. So we'll move on to the requirements for the application submission. And before I list out all of the required documents that are listed in the NOFO, I did want to make sure to point out that this information is located in section 4.2, which is the content and form application submission section in the NOFO. It lists all of the mandatory documents for your application submission, and in the next slide, you'll see all of those documents listed. But for the purposes of this TA webinar, I did want to mention that for any grant-specific forms that you see listed, for example, the lobbying form, which is the SFLLL, please do reach out to the assigned grant management specialist, which is Mr. Andrew Diggs, for any questions about those grant-specific forms. Because he is based in the Division of Grants Management, he can answer any questions you have about those required forms for this application. One of the things that you would do, or you would reach out to me for, is to ask questions about maybe what's contained in the abstract, what information or questions you might have about the project narrative, the work plan, the timeline, things like that. Things like the tribal resolution, letters of commitment, your 501c3 forms, you would reach out, for example, to Mr. Andrew Diggs for that. Again, I won't read off this list to you one by one. We just wanted you to know what all the required documents are for this application. But please remember, and within the NOFO itself, there may be some additional information for each one of these required documents, so please go to the NOFO to see any additional information for these specific required documents. So before I move on to the project narrative components, I'm going to wait just a minute or few seconds. I think there is a question that somebody has. I'm just waiting for it to come up in the questions box. But I'll try to stop periodically for everyone for new questions as they come up moving forward. So moving on to the project narrative components, what we're going to do now is begin talking about how you start preparing your project narrative. You really, of course, always want to make sure that you are reviewing all of the questions that are being asked in the NOFO so that you can succinctly address and subsequently answer all of those questions and address all of the required application components, making sure those responses go in the correct section so that they're not missed. In some instances, folks will mistakenly put content in the wrong section, and then it actually won't get scored because it's not in the correct section. So please review applications, making sure that you're putting the information in the right section of your application. We do want to remind people to really adhere to the page limitation requirements for this NOFO. Any documents that we receive that exceed the page limitation requirements will actually only be reviewed up to the specific page limitation. So for your project narrative, you can only submit a project narrative up to 15 pages, and any additional pages beyond that, should you include them, would not be reviewed by the ORC or considered. When we move to the next section, we'll be going over exactly what pieces of the project narrative the Objective Review Committee will be reviewing. And when we go through that outline, we do that so you will know exactly what the ORC will be reviewing and how they will become familiar with your application in full, so that they can properly review and score your application. So again, the project narrative component should not exceed 15 pages, and really what the project narrative is you describing the proposed scope of work. This is where you list your goals, your objectives, you speak to any objectives listed in the NOFO that are required, and additionally you list your project activities that you would use to accomplish those goals and objectives. please remember that for the project narrative itself and specifically, this section does not include the abstract, any of those standard forms, the SF424, 424A, the SFLLL, tribal resolutions, your budget and your budget narrative, or any other appendices that you might submit. The project narrative is specifically limited to you being able to describe your scope of work, and that is what that full 15 pages is dedicated for. So if you go to the NOFO, you would find this information in the project narrative section 4.2a, and it will list all 4 parts to the project narrative. Part 1, the statement of need. Part 2, the program plan. Part 3, organizational capacity. And Part 4, program evaluation. And all 4 parts of this project narrative should be answered succinctly and address all the items or objectives that are listed in section 5.1, which is the evaluation criteria. And I'll go over that in more detail once we start moving through the sections, so you know how the sections are scored. So moving into part 1, which is the statement of need, it is limited to 2 pages for your application. And in the statement of need, you really should be addressing the nature and the scope of the problem. And in this case, that would be domestic and sexual violence, child maltreatment, sexual exploitation, and human trafficking. In this section, you're able to use data that provide you with, that will provide and describe the problem, the effects it has on the population that you will be focusing on, and how it affects the community at large. In the last bullet, we give you some examples of different types of data sources that you can use. You can use local data that comes from the Trends in Indian Health data manual. You can use your state data. You can use national data from the U.S. Census Bureau, the CDC, the Department of Justice, and SAMHSA, or the National Survey on Drug Use and Health. You don't or are not required to use just these sources. These are just some examples of data sources that you can use during the application process for the development of your statement of need. So part 2 of the project narrative is the program plan, and this is limited to 9 pages. And in the program plan, you're going to outline your goal or your goals and how you propose to implement the required 6 objectives for this notice of funding opportunity. And you will see those 6 objectives listed here in the middle of this slide. And in this portion of the project narrative, you are going to, this is where you're going to outline your goals, your own objectives, your activities on how you will address each one of these required 6 objectives for this notice of funding opportunity. We do suggest that, again, you reference section 5.1, which is the evaluation criteria, for a more detailed outline of examples for each of these individual objectives. The information is vast that is included in the NOFO, so please do take a look at the NOFO itself so that you can understand exactly what each one of these objectives is speaking to, and for examples, should you need them. Part 3 is the organizational capacity, which is limited to 2 pages. Really and essentially, in this section, you are going to be describing you as the applicant's management capability and experience in administrating grants, and really identifying what division or department of the tribe, tribal organization, or urban Indian organization it is that will be administering this project. You'll describe the capacity the organization has to provide culturally relevant services to the tribal community in which you serve. You're going to describe the various resources you have available to you for this proposed project, such as your facilities, your equipment, or your IT systems. You're going to be describing your past organizational experience in implementing cross-system collaboration that is specific to addressing domestic and sexual violence, child maltreatment, and sexual exploitation or human trafficking. And then you're going to describe any types of advisory bodies that include membership, roles, functions, frequency of meetings that this body might function to as a portion of your cross-system collaboration or as a work group. Continuing with organizational capacity, you do and will want to address how your project continuity will be maintained if you have a change in staffing or staff turnover. We do definitely see this a lot with projects and realize that there can be a fluctuation in staff at any given time, so please do make sure you address how your project will maintain stability over the life of the grant should you experience staff turnover. In this section, you'll also describe the staff positions, including the role and level of effort or percent committed. For example, that's what most people refer to as FTE. So in addition to any direct service staff, your full-time project lead or coordinator is recommended to serve as a primary point of contact. That person would manage the implementation of the overarching project, the objectives, and continue to do that over the course of the funding cycle. When you do, or if you have already identified individuals for key positions that are currently already on staff, we do ask that you submit a biographical sketch or sketches for those key positions. You are given a template on our DBH website and for you to use for each individual bio sketch, and this information should not exceed 1 page per person. And you would submit those under other attachments in grants.gov. So the biographical sketch, again, is not included in your project narrative page limit. That is submitted separately with your application, but also will be considered as part of your organizational capacity or part 3 of this section. We do recommend and ask that you do not include any personally identifiable information such as social security numbers, home addresses, nor that you include resumes or any curriculum vitae that might include any PII with this application. Let me pause there just for a second before we move on to part 4. I see there's a couple of questions in the chat. So Debbie's question, is the lead project coordinator required to be 100% FTE full-time, or can it be less? Debbie, that will be up to you on the part of the applicant. We do encourage a full-time project coordinator for these grants. We have seen over time that that is the best way to ensure stability over time. But again, that is up to you. We've seen projects function with project coordinators that operate less than full-time. So as long as, or if you will be doing it less than full-time at 100%, please do remember to justify the reasons why in the application. Alyssa, your question was the same question. is the project coordinator required to be at 100% FTE or recommended at that level? So hopefully that answered both of your questions. If you need further clarification, just go ahead and type that into the chat. So moving on to part 4 of the project narrative is the program evaluation, which is limited to 2 pages. In this section, you are going to describe for the reviewers your plan on gathering data, which includes data related to any evidence-based programs and interventions that you are proposing, how variables will be measured, what method or methods you will be using, and how the data will be used for quality improvement and sustainability of the program. You are highly encouraged to partner with either your tribal epidemiology center or your urban epidemiology center. And if you do decide to do that, please include a plan for how you will coordinate and collaborate with your epicenter in your area. We want to make sure that you are able to describe how you will prioritize screening efforts as a tool in identifying American Indian and Alaska Native women ages 14 to 46 who are at risk for intimate partner violence and or domestic violence, so that those individuals can be referred for appropriate services and data can be collected for the Government Performance Results Act or GPRA measures related to IPV and DV. We would ask that you describe how you will prioritize your screening efforts as a tool in identifying people who are at risk for sexual exploitation and human trafficking, so that those individuals can also be referred for appropriate services, and how that data will be collected. And describe your plan to establish necessary data sharing agreements that will be used in support of these evaluation and data gathering activities. So before I move on to the next section, there's a question in the chat from Caitlin. What screening tools are considered gold standard for AIAN individuals for IPV and sexual exploitation human trafficking? Caitlin, I will give you a link to the best and promising practices and models and or trainings that we have listed on the DVP IHS website that you can go to and reference. I will tell you that we are not requiring specific screening tools. We do leave that up to the applicants to identify those screening tools, but we do have recommendations that are listed on the IHS DVP website, and that link will be at the end of this presentation. And should you have any questions about types of screening tools, or if you need any help navigating that website, please feel free to email me directly, and I can assist you. If I cannot assist you, I can get you in touch with somebody within my division that can, okay? Yes, and Caitlin, I see your follow-up. You want to make sure that you're using best practices, and that website will help a lot with that. But again, if you go to that website and you're just not finding anything that might meet your community needs, reach out to me, and then I can help you, or I can put you in touch with somebody who can. Okay. So that concludes the breakdown in 4 parts of the project narrative. And now we're going to move into briefly describing the budget and the budget narrative components. So for the first portion of the budget, you are required to submit a line item spreadsheet, or what is referred to in the application as the SF424A. You want to make sure that your budget breakdown, your budget line item spreadsheet matches the program and the work plan that you describe in your project narrative for this first budget year, for the first budget year expenses only. Please make sure to include any travel funds that you might need for your project director and or coordinator to attend an annual grantee meeting. I do say that, and I will preface that with the fact that IHS is still following COVID restrictions. So we hope to plan and have an annual grantee meeting where folks might be able to travel and be in person. However, we do understand that that might not be the case. So we do still encourage you to include travel expenses in the event that we do have and can hold an in-person meeting. One point we did want to make is that to be very careful about how you in the line item spreadsheet how each item you put in the other category is justified. And I'll go into that in a little bit more detail when I get to the next slide about the budget narrative, the budget justification. It's very, very important that you are aware that applications with a budget higher than the upper limit that are submitted for review will be deemed ineligible. What I mean by that is in the first portion of this webinar, I gave you a range in awards from, let me pull the slide up so everybody is on the same page, that individual award amounts for the first budget year are anticipated to be between $100,000 and $200,000. And what this means here is that if you submit an application that it is with a budget that is for $250,000, which is higher than the upper limit, your application will be deemed ineligible and it won't be reviewed. So please keep in mind that your higher end limit is $200,000. We understand that there are some programs that might not need $200,000. You might need as little as $100,000 or anywhere in between. So please be mindful of that budget because this is one of the first screening items that will be done within this process. Before I go on to the next slide, Debbie, I see you have a question about the budget. For the budget for the annual grantee meeting, what location would we be using if the meeting is held in person? Debbie, it's probably a safe bet to use a location like Denver, Colorado or Albuquerque, New Mexico. It's pretty centrally located for Indian country. I believe in the NOFO that one of those two cities might be the city that's given as the example, but it would be safe to say that, you know, either one of those locations centrally would be good for you to use to determine travel funds for your budget. So moving on to the second portion of the budget is the budget narrative, and this is limited to 4 pages. What the budget narrative is essentially the justification on what you have outlined in your line item budget, and it really just explains the why you need funding for that particular budget line item and justifying the amounts that are requested for each line item. And this budget narrative can include a more detailed spreadsheet than what is provided in the standard form that you submit for your application, but you really need to make sure for the budget narrative / justification that you describe how each item will support the achievement of your proposed objectives. So for example, if you are listing in your budget that you will need training for you know, the youth in your community, in your line item budget, you're going to name the training, you know, any speaker fee that might come with that training, any travel that might come for the speaker if they're going to be going to your specific location. And then in the budget narrative or the justification, you outline that particular training is a best practice or a a training that has been utilized by your community, for X amount of time, and that these are the costs associated with that. So you're really just justifying whatever content it is that you've added and put into your line item budget. We do ask that you please do not use the budget narrative to expand your project narrative. You can't reduce the number of budget narrative pages and add on to your project narrative. We have seen that happen in the past, and again, as I mentioned, you will not, anything beyond the 15-page project narrative limit won't be reviewed. So I'm looking at time. It looks like we're pretty good on time, and we're coming up to the last few slides. And before I move into the application templates, I want to, there's a question from Alex in the chat. Can you provide more information about prioritizing screening tools as it relates to GIPRA? Are applicants required to report GIPRA measures? Is the applicant required to report screening data? Alex, that question is a question that will need to be answered by the IHS DBH data coordinator. I can't speak specifically to that particular piece in the evaluation section of the project narrative. If you would, please send me an email directly so I can make sure to pass that along to the data coordinator within my division. Please know, too, that, and this is for everybody's reference, any questions that we get about GIPRA or GIPRA measures related to this NOFO, we are developing a frequently asked questions document that will be posted on the DVP website. This is one of those questions that we will include in that. So Alex, we've gotten this question a couple of times before, but because I cannot give you the exact answers to that, I want to make sure that you get the information you need. So please just send me an email directly, and I can get that question addressed for you. Okay. So Gina also has a question in the chat. Will you clarify, give examples on the difference between local versus community organization under required commitments on page 9 of the NOFO? Gina, I don't have, so when you say page 9, I don't have the NOFO itself up in front of me. I have the Federal Register NOFO, which is really just all one web page. So maybe if you can clarify that a little bit for me. I want to make sure I have time and can finish going through the slides. So Gina, if you can just try to clarify that for me, maybe I can answer that more specifically at the end when we open it up to everybody for questions. Okay. So moving on to the application templates, the Division of Behavioral Health does have available on the DVP webpage the following templates. And the 3 of the 4 were posted just last week: the timeline chart, the biographical sketch, and the budget and budget narrative template. So we are still waiting to get clearance for the actual project narrative or proposal template. So that will be forthcoming, we hope, in this week. And hopefully it'll get posted by the end of this week. All of that being said, using any of these templates is not required for your application submission. We do strongly encourage it because they are there, they are available to you, but if you choose to outline your application, your narrative in a way that works for you, that has worked in the past, please feel free to do so. Again, these are just options for you that we have on the website, and the website link is there at the bottom of this slide. So as we move forward, I'm going to go over just really briefly how to prepare a strong application. We do want to make sure that you continuously keep the evaluation criteria in mind when you're writing the application. That section 5.1, evaluation criteria in your NOFO, is very, very helpful for you to reference. That is how the process in which all the applications will be scored. You want to make sure that your narrative content is complete, it's written clearly, and it addresses all the criteria that's required. And we do want to encourage everyone to be mindful of not assuming that your ORC reviewers are familiar with your organization, your service area, or any barriers that you might be experiencing or your community might be experiencing to healthcare, your healthcare or healthcare needs in your area. The reviewers are given these applications, but you want to make sure that you give them a very clear and concise background of what you are submitting. So please just remember that. And when you take a look at the evaluation criteria, that will also help in developing your application. You also want to remember to begin preparing your application early. You want to make sure you have enough time to gather all the information you need, all the data. You reach out to individuals that you might need to have in finalizing your application. This application is open for a total of 90 days, which is approximately 3 months. And as I mentioned at the beginning of this webinar, we are just over the 33-day mark. So please just be mindful that we are also coming up on the holiday season, and that the sooner you start preparing your application, the better shape you'll be in order to submit it early and or by the deadline date. I've said this throughout the webinar. You just want to make sure that you're being concise and you're clear throughout your application, making sure your points are understandable. You're providing accurate information that you are going, on how you're going to address the problem in question. But you also want to make sure that you're being realistic in your plan or plans to address the issue. You want to make sure that if you have any required information or data that is going to be omitted, that you explain why that is the case. Make sure that the information provided through the application is consistent. So if you are being asked in one section to talk about the problem, the issue, for example, that you are clearly referencing the same problem, the same issue throughout the application. Make sure that your budget reflects your proposed program activities. Anything that you're proposing in your activities that will have a cost to it, please make sure to include that in your budget line item spreadsheet and in your budget justification. Again, the next bullet, we do provide you the templates. We highly encourage you to use them, but again, you don't have to. But if you choose to, please do read and follow all of the instructions at the beginning of each template so that you can accurately fill out the form or forms. Make sure to follow any formatting guidelines that you are given when you're preparing any of your narrative content. This is outlined in the NOFO. The NOFO references your page limitations for each section if they're applicable. Make sure that you also adhere to spacing requirements, the allowable size font, and your page numbering requirements as well. Please do remember to proofread the application before you submit it. Whenever there are either misspellings or grammatical errors, that will definitely make it harder for your ORC reviewers to understand and follow the application, so just make sure you proofread beforehand. And carefully review a copy of your application package to make sure that it is accurate and it's complete. We recommend printing it out before you submit it, reviewing it page by page just to make sure it's complete and all the required documents are included. We have seen in the past where we will have an application missing 1 or 2 pages and pages or forms that are required. So please just make sure that before you hit submit that you've carefully reviewed your entire application package. So before I move on to this brief overview of how the applications will be selected, I want to do a time check. It is right at the hour, and it probably will take us no more than 10 minutes to get through the remainder of content for this webinar. At that time, I'll go into questions. But before I move on from the budget section, there's a question from Melanie. Do budgets and timeline need to be 5-year or is it yearly? Melanie, for this application, you are asked to submit a budget for the first project year, for this year. So your timeline and your budget need to be for this first project year. Now, there is also a section in the NOFO that references multi-year projects or programs. If what I'm sort of hearing from you might be you alluding to that section, please reach out to your grants management specialist that is assigned to this NOFO, Andrew Diggs. His office, his division, the Division of Grants Management, will be able to speak to that multi-year component of the NOFO. That is a grant-specific item, requirement, piece of information that unfortunately I cannot speak to, which is why it's not included in this TA webinar. So please just reach out to Andrew Diggs if you have questions about the multi-year component to this NOFO. But again, to answer your question, for this application, the budget and the timeline are for this first project year only. So right now we'll move into how the applications are reviewed and selected. They give you, in the NOFO, this section is section 5.2. And it goes over all of this information in more detail, but the highlights are that when each application is submitted, it will be pre-screened for eligibility and completeness as it's outlined in the funding announcement. Those applications that do meet the eligibility criteria will then be moved for review to the Objective Review Committee, or the ORC, and those reviews will then be based on the evaluation criteria that I've referenced throughout this webinar today. Any incomplete applications and applications that are not responsive to the administrative thresholds, for example, the budget limit or the project period limit, will not be referred to the ORC and will not be funded. If this does happen, the applicant will be notified of this determination. Applicants must address all program requirements and provide all required documentation. So when we actually move into the evaluation criteria or scoring, once it gets moved to the ORC, eligibility is confirmed, all your required documents are there, the ORC will receive those applications, and it's at that point that they will be basing their review on the selection criteria that you see listed here for each one of the sections we've reviewed today: the statement of need, the program plan, the organizational capacity, program evaluation, and the budget and budget justification or budget narrative. And each of those sections have a set of points associated with them that total 100 points. So again, the evaluation criteria in section 5.1 is listed in the NOFO for you to reference. It clearly outlines for each of these sections what is required for each section. It gives examples, and that's how the ORC will base their points, how they will be awarding points for each section. So please do reference the evaluation criteria. Again, that is very, very important in making sure that you are addressing all of the requirements for this application in terms of scoring. So moving on to the last 6 slides of this webinar, did want to give you some helpful web pages for application preparation. The most current and up-to-date information will always be listed at the DDP funding announcement website that you see listed first here. I did mention in response to a question earlier that the DDP webpage has a models, trainings, and best and promising practices webpage that you have listed here that you can use as a resource in creating your project proposal and application. And then again, we encourage you to connect with your local tribal epidemiology center or urban epidemiology center to find out what data might be available to you to include in your proposal. And you can see a list of all of the text there at that link at the bottom of this slide. I mentioned at the beginning of this webinar that I am one of the agency contacts that is available to you for questions. Please feel free to email or call me if you have any questions that pertain to any programmatic issues, anything we might have gone over today regarding the project narrative or the program content for this NOFO. Should you have any questions on any of the grant-specific requirements or grants management or fiscal or budget matters, please reach out to the grants management specialist, who is Andrew Diggs, in the IHS Division of Grants Management. And then if you have any questions on any of the systems that might be related to this NOFO application process, you are going to reach out to the Acting Director of the Division of Grants Management, Mr. Paul Geddes. This TA webinar today has been recorded, so once we are done with this webinar today, we will make sure to get this recording posted to and with the PowerPoint slides to the DVP Funding Opportunity webpage, so it will be available for you to review again should you need it, or if you have any tribal partners or folks that were not able to join live today, you will be able to share the recording link with them and the PowerPoint slides as well. The PowerPoint slides are available for download in the bottom left-hand box of your screen for you to download immediately today. I also will be holding virtual office hours over the next 9 weeks, which will be held via Zoom. So this is a chance for you to, if you haven't already, reviewed the NOFO in detail, and that time and space is available for people just to join, ask questions. You don't have to stay the full hour. You can come in, ask your question, and then you can leave. You can also send me direct emails. The virtual office hours are there just for convenience so that applicants know when they are able to join and ask any questions they might have. Keep in mind that I will not be presenting any of these slides. It is not a formal presentation. It is just a chance, an open time for people to come and ask questions directly. All the links to the virtual office hour sessions, any call-in information that you might need is located on the DVP Funding Opportunity webpage. So please make sure to visit the webpage as often as you need to look at the scheduled dates and times that are available for these virtual office hours because they are subject to change. I do have the following dates listed for the time of 2 to 3 p.m. Eastern Time. Now that is a standing time for each one of these dates. So through Monday, January 31st, I will be available for that hour, 2 to 3 p.m. Eastern Standard Time for questions. Outside of today's scheduled TA webinar and my scheduled virtual office hours, all applicants should continue to reach out to any of the agency contacts for any questions. Outside of any of these designated TA sessions, calling, sending emails, that is always available to you up through the deadline date of this NOFO. And that being said, we will take the remainder of the webinar time, about 20 minutes, for any questions that folks might have for this NOFO or the TA session. Gina, I do see that you clarified your question. See if I can go through this. Let me pull up the NOFO. The link to the, bear with me just a minute while I look for Gina's question. Okay, so Gina, so when it talks about the letters of commitment, it says for all applicants from local organizational partners, for all applicants from community partners. What I can discern from that is that for the purposes of this application, they want to see you distinguish between local organizations such as maybe your Boys and Girls Club, for example, versus your community partners, which might be your, your local social services, Division of Social Services. So those are my examples and what I can think of in terms of your question. What I would also recommend, Gina, is that you reach out to Andrew Diggs and ask him the same question. What we've seen in the past is, for example, we've had previous grantees that have partnered with their Boys and Girls Club. And this is not for DVP, this would have been for a different grant. But they partnered with their Boys and Girls Club, which meant that when they decided to do that and submit their application, they would have had to have a letter of commitment from the Boys and Girls Club so that if we knew we funded them, they had already had that conversation and they had already committed to, if you get this funding, we will have this partnership, we will move forward with this together as a tribe and as an organization. Community partners I interpret being anywhere from, like local community entities that might be, if you're dealing with youth, it might be your local school, for example. I understand, like from this, at least maybe what I can discern from your question is that there's just a hard time distinguishing between the word local and community because I think we think of them as interchangeable. I would recommend reaching out to Andrew Diggs. Please feel free to, if you're going to email him, to copy me on that email. I will also take this question back to the IHS data coordinator for my division, so I can maybe get her interpretation a little bit more. I will say that for this notice of funding opportunity, this is a grant-specific requirement. So this is not something my program office required for this NOFO. It's included in just about every NOFO that IHS would put out within our larger office. So it's the same for example, for other grant programs that I oversee. But Gina, if you, again, you should feel free to send me an email directly, and I can make sure to put this on my radar to get back to you and get you more information on, because I realize it's a little hard to tease out right now. So I hope that's helpful, and I'll do what I can to get an answer out and maybe put that in the FAQ for this NOFO that's forthcoming. Okay. I don't see any other questions in the chat right now. Okay, so I want to be able to, we have about 15 minutes left, and I don't want to end this early. If there are any additional questions folks might have or clarifications. So you should feel free to jump off if you need to, and I'm happy to stay on for another 5 minutes. I don't see any other questions coming in the chat. There is one that just popped up from Delilah. Are there any of the past awardee grant applications available for the public to review? Delilah, unfortunately, I don't believe that that is an option. Any previous grant applications, you would have to directly reach out to previous programs or projects to make that request individually. IHS is not able to share that information once they're accepted by us, and I believe that is a grant-specific policy. So if you know any past grantees, I would suggest reaching out to them directly to make that request. Lila has another question. What type of professionals are typically leading the work? For example, social workers, program coordinator, health educators, therapists. Delilah, we've definitely seen it run the gamut of who kind of coordinates this type of work, and it really just depends on the project itself. If the grant program is something that is more clinical in nature, we have seen those programs being run or coordinated by somebody with a clinical license, for example, a social worker. If the program is more prevention-based, we have seen grantees employ health educators if the focus is purely on prevention and education efforts in their community. So it really just depends on how you are going to develop your program and the best fit for how you want somebody to run that program or that project for you. So it's really up to you. I will say that in terms of an application process, making sure those two things match up is important. But again, we have seen folks who are social workers have a program management background. Before they were a social worker, they ran X project out in this community, so that they have some program management experience. If you find that you might have staff on board that you want to run your program or your project, please just make sure that they outline their experience in their biographical sketch. That's really the place where that would go. So I hope that's helpful. I'm waiting for any other questions that might come through in the chat. Looks like there were a couple in the TA box, but they got moved to the chat. So if there aren't any further questions, or if you want to stay on, like I said, another 5 minutes or so to ask any other questions you might have, please feel free to do that. I do want to thank everybody for joining today's technical assistance webinar. I hope this information was helpful. Again, please do visit the DVP NOFA webpage. Reach out to me or the Division of Grants Management for any questions you might have. And if you don't have any further questions, thank you for joining, and I hope that you have a good rest of the day.